So even though I teach a general biology class, I try to incorporate things from what I've learned with public health. So when we talk about bacteria, for example, I'll bring in foodborne illnesses. When we talk about organ systems like the nervous system, I'll talk about the impacts of lead on the nervous system.
You're listening to Cold Press Conversations with Dr. Jewel White Williams, a lover of numbers, lists, and a good glass of cold pressed juice, who is sharing episodes each week to help you explore the back end of healthcare and health sciences. Where a lot of that grit is done, we'll dive into topics covering research, education, and clinical practices, as well as guest shows with other leaders in the field. Pull up a seat and let's dive into these amazing and game-changing conversations. Hello and welcome to Cold Press Conversations. And today I am having a wonderful guest, Dr. Kimberly M. Robinson. And it is just a delight to have you here.
Thank you for having me, Dr. Jewel. It's a pleasure. I'm excited.
This is it's super exciting. A lot of people don't really realize our connection. And so I hope you don't mind. I'm going to give a little connection about who we are. Is that right?
Sure, yes.
Okay. All right. So Dr. Robinson and I met, of course, online because we both were in a graduate program to get our doctorate. And it was exciting because I had completed mine. And she was like, you know what, Jewel? I'm not sure, Dr. Jewel. What do you think? I said, you need to finish as well. So she was like, I don't know if I have the energy. And that is one of the things I did talk about earlier. We're not going to go into all the dissertation stuff, but it takes a lot of energy, mental, physical, you name it, spiritual energy in order to complete a doctorate. And I said, you know what, you're going to have all three of them. I think you have it. I know you have it. I'm not going to think anymore. We're going to say you have it. And so we went on ahead and said, you know what, we're going to make sure that this works. And we're going to make sure that you walk away as Dr. Kimberly M. Robinson. And it was more than as a light because the process, we learned so much about each other. And that's one thing about teaching or educating. We learn so much about each other in this process. And I think, don't you think you learned a lot about yourself in that process?
Absolutely. Yes.
I declare. So just to give a little hindsight, some people really don't know who I am. I am Dr. Jewel White Williams. I am a researcher, an educator, as well as a clinical practitioner. In a sense, I do work as an EMT, and we do work on trucks, and we do work with patients, okay? And it's just a different type. I have a doctorate in health sciences, not an MD, and I'm a person who loves to learn. And on top of it all, I'm having cold press conversations because I really and truly want to extend out and go into the depth of understanding what it takes to be someone who is in health sciences. And that's why I have Dr. Kimberly Robinson with me today. I just want to give a little introduction as to who she is. She is a distinguished figure in the field of public health, dedicating nearly 2 decades to serving communities through her pivotal role at a local health department within the state of New York. With a supervisory position overseeing program management and instruction for the Food Managers Training Course, Dr. Robinson demonstrates a steadfast commitment to public welfare and environmental health. Alongside her professional role, she has passionately shared her knowledge and expertise as an adjunct professor for 17 years. Enlightening students in various subjects from biology and physiology. Her contributions extend to public health curriculum and course development consulting, shaping educational programs at both community colleges and universities. Dr. Robinson's academic journey reflects a lifelong commitment to advancing knowledge and contributing to public health. Beginning with an associate's degree from a local community college and culminating a doctorate in health science from the University of Bridgeport, she has acquired a diverse range of qualifications, including degrees in biology, public health, and health science. Throughout her career, Dr. Robinson has fearlessly embraced challenges, including stepping into a leadership role during the coronavirus pandemic as a manager of the Coronavirus Center for her local health department, ensuring that the public's understanding of the virus and safeguarding the health and welfare of the residents. What an impressive resume.
Thank you. Thank you. Thank you. I can't believe it's almost 2 decades of being in this field. It seems like yesterday I just started.
Did you hear yourself gasp? You were like,
Yeah. I was like, what did I do? Am I crazy? No.
I'm loving it though. I really do. I really, really like it.
It's been a wonderful journey, and the journey's still going.
Is it really?
Still on.
You
Yeah.
think it's still going?
Yes.
I want you to tell me about the going then. Because if we consider to all your experience, and especially the management that you've done, I want you to just elaborate on your experience in program management within the local health department. Like, what exactly does it focus on? What approaches, or how do you address public health concerns? How does it even work? Help us understand that.
Well, for me, program management at a supervisory role right now is making sure we get to all of our food service establishments, because part of our role is to make sure that a lot of our food operators out here in my county follow the state sanitary code, and we educate them, because we get training all the time. Things change. You know this, data dictates the changes. But we have to make sure that the food operators adapt to that change, that they make corrections, that we prevent foodborne illness. That's the main role. So for me, it's just making sure that my colleagues who are under my, I guess, supervisory leadership, that we get the job done by making sure that we do our inspections and keep our residents safe.
I really like what you state. When we think of public health, a lot of people don't realize the connection that it has to science, to health science. And while you were attaining your doctorate, you and I had a lot of discussion about that.
Mm-hmm.
Can you go into depth about that a little bit to help us understand the connection?
Okay, so what I didn't get to, I guess, announce is that I'm a public health sanitarian, AKA health inspector.
Okay.
So people really don't know the role of a public health sanitarian, but for some reason they can relate to the title of health inspector.
Yeah.
And when they think of the role of health inspector, they think solely of restaurants, and that's all we do. But no, we are definitely behind the scenes. Actually, you wouldn't know we were around until something goes wrong. That's when they look towards us. But we know we're doing our job, because our job is about protecting the public, right? It's about prevention, and that is public health. I'm under one arm of public health, which is environmental health. And that's where I've been for the past 19 years. So my role as a public health sanitarian actually started with tobacco control, ensuring that the retailers weren't selling cigarettes to minors. And that program has since expanded, because as you can see, there are a whole bunch of other tobacco products out there, vapes, you name it. They're getting a little bit more creative with that. And so with that happening, there's more work for us to do. From there, I used to investigate residential complaints. Just like any other suburb, I investigated rodent complaints on residential properties, landlord-tenant concerns, where the tenant wasn't receiving services. That was a heavy-duty task as well, because with that program, especially when we talk about rodent behavior, it's about our human behavior. Where they're humans, there are rats, unfortunately, and our behaviors contribute to the problem. So that was an interesting program, and that program was very dynamic, and I think that's the program. It was the Office of Community Sanitation. Allowed me to work on my people skills more. And I'm going to tell you, I learned a lot about conflict resolution. If you talk to anyone, they know that if I go out there and I deal with a difficult person, we become best friends afterwards, somehow, some way. So public health is very dynamic, and where I'm located is just a small one puzzle piece of the big picture of public health, which is under the bigger umbrella of health sciences.
Wow.
And so just to not go too much into my field, but
no, it's fine.
Okay.
The reason I have you on is because I learned so much through you over that year and a half, almost 2-year process. So I felt like people need to understand that when we look at health sciences, one thing that I just finished talking about to someone else, there's healthcare and there's health sciences.
Yes.
They're two separate things. And when we look at both of them, healthcare, they go hand in hand, but the health sciences is the back end, the stuff that helps people become even better. And it actually helps inform health care.
Yes. Yes. And I had to do some research on my own to see what other college programs were doing with health sciences. And some do include the health professions, but also the things that support those health professions. So you're absolutely correct.
Yeah, yeah.
I had a taste of that as well, working with the health department, working with our medical staff.
Tell us a little bit more about that, if you can, just a little bit,
Sure. So after I moved on from the other two programs, I then became a certified lead risk assessor through my job. So then I was in the lead program where we were investigating cases of children who had elevated blood lead levels. And you learn a lot in that program. It's mandated in my state that children get tested at ages 1 and 2, I believe, for lead. Because past a certain age, it's very hard to, how can I put it, for a child to recover. Because once you have a lead, ingesting lead over periods of time, there's significant health risk involved. Delays with learning, you name it. It could be very detrimental. So you want to correct the problem as soon as possible. So my role was to get to the source of the lead problem. And what most people don't realize is if you are living in a house that was built before 1978, most likely lead paint was used in your home. And so as you're updating your home, you have to be very aware of what is flying around in there. You have lead dust, lead is heavy. And we look for the characteristic thing with lead, which is the chipping paint. That's a very good indicator of, this is lead paint, and you can get it tested. And we also use special equipment to check for lead. But that program is definitely needed, especially where I'm located. We still have a lot of old homes out here, believe it or not, from the 1800s. I think the oldest home that we were involved in was from the 1700s.
Wow. Are you still, and people were still living in it?
Yes. And with children, it's a lot of hand to mouth. They're, the children are crawling on the floor, they're everywhere. So I had one child who just took me to each spot where he was picking the paint and eating it because it has a sweet, somewhat sweet taste, and it becomes addictive. And this child, who was only 3 years old at the time, was giving me a tour of his lead experience.
No, he didn't.
Yes. From windowsills to baseboards, you name it. He was all over the place partaking in lead.
Yeah, lead journey. That's kind of sad though. So how do you connect it? Let me go. So is it that when you discuss with the community, and I'm big on that.
Absolutely.
I really am big on allowing the community to truly understand that it imparts a team.
Absolutely.
Even in a hospital, there are teams that meet for the best needs of patients before they're discharged. So when we look at a team, there are teams, if there was a death in the process of a 911 call and it was a pretty bad accident or really bad situation, should have been a bad fire, we do have teams that do come out to help work with the firefighters and the EMS. Same with you have teams. And I think a lot of people are unaware that the health care and the health science and the public health field have teams in order to reach out to the community. How does your team work? And I'm going to twist it a little bit. You stated that you manage the coronavirus center.
Yes, I was one of the managers for the coronavirus call center. Yes, absolutely.
Oh my gosh. And it's still prevalent. A lot of people don't realize it's still active. Some people say, well, I thought it's gone. We just don't talk about it as much, but it's just as prevalent. What were some of the common concerns or misconceptions that you may have had to deal with, or even just give us the experience of what it was like to be in the call center to help educate the community?
It was a very challenging time because for myself and a lot of colleagues, our loved ones were being impacted by the coronavirus, and we still had to show up to work every day. And we were working with the state to deliver the information to do case investigation and contact tracing. So if anyone is not aware, case investigation is when someone has a confirmed diagnosis of, in this case, coronavirus, and we had to reach out to them, do an interview, because we have to figure out who they possibly exposed the virus to.
Right.
And also we wanted to make sure they had the services because we knew they were going to be home for quite some time. So, did they have enough food? Did they have their medications? We had to go through the whole list with them, and we had to follow different prompts in a system that was designed to handle case investigation. And then once we were able to figure out, okay, who they were around at that time, then we would have to reach out to them to let them know that they were exposed. And in turn, they had to quarantine, right? So the case had to isolate because they had a confirmed diagnosis, but the exposed people had to quarantine because they were exposed to the person with coronavirus. So you tried telling people, hey, you were exposed and you have to stay home for 2 weeks. Sometimes you weren't getting great responses from them because they were upset. They were nervous. They were upset. And like I said, part of my job and really my time with my local health department has helped me deal with people. Because one thing I've really began to understand is that the public sometimes doesn't trust government. So here I am in this government role, and I'm trying to educate you, I'm trying to inform you, but you may be a little resistant. So then I try to find some common ground. I listen. I learned that when people feel a certain way, I ask, well, what's going on with you? Tell me, what have you experienced? And then I get to listen to them. And sometimes that's all they want to know, is that someone is listening. Then as I'm listening, I try to say, okay, how could we kind of like do some problem solving here and resolve this? And a lot of the time I am successful. That's a big thing, active communication and problem solving when it comes down to public health. Just like any other field, there's a lot.
Yeah, we deal with a lot collectively. And I think a lot of the public health and the public type positions that are out there, we deal with a lot of community. And it's a form of educating. And educating is a talent because not everyone has the acumen to do so.
Right.
You need to know exactly how to work with them, how to talk to them, not be condescending, making sure you have the right tone, using the right words. And I express that because you're telling us that it is just like that. You have to meet to where they are for that situation and try to build a quick relationship to give them the knowledge that they need to have.
Right.
I do want to discuss one thing, and I used to during the coronavirus when it was at its height, and people were doing many research studies, and they will tell you that the studies were probably not as solid as they wish, but they wanted to at least put something out there. Not necessarily clinical trials, but just talking about what's happening. And they talked about the sanitation part, and I just want to discuss that. Were you familiar with when, and I may not have the right terminology, so please forgive me, but were you familiar with the part when they stated they were monitoring the sanitary part of where the clusters were for the coronavirus through fecal matter?
I did vaguely hear about this. I didn't get to review the study, but I did hear this. And honestly, does it surprise me? No, because out here, I live by a big city. They found polio in the water system at some point. So, these things will reveal itself over time. I feel there's going to be more and more information that we get from what happened in the pandemic.
I want to talk about your adjunct stuff. Is that okay?
Yeah.
I'm really, it's piquing my interest. So you have a diverse range of degrees: biology, public health, and health science. So give me a little bit more about how I hate using this word, how do you teach to students? I don't like that, but I think you get where I'm coming from. What is it that you do to help other students relate to public health from the holistic view to its minute view, for them to know how to focus on the different directions that they could go?
Yes. So what I teach is actually biology for non-majors. So I love this because this is where you can kind of open the floodgates of information to them. And like I said before, I mean, it's getting better now, but most people really didn't know about public health or didn't think about public health as a career option. But I have to say, over time, I'm seeing more and more people enter this field, which is a good thing.
Yeah,
That's what I'm trying to contribute to. I'm trying to make sure we have future public health professionals who can take on the role of dealing with the challenges that we're going to be facing. You know, the challenges aren't going to end. Even though I teach a general biology class, I try to incorporate things from what I've learned with public health. So when we talk about bacteria, for example, I'll bring in foodborne illnesses. When we talk about organ systems like the nervous system, I'll talk about the impacts of lead on the nervous system.
Excellent.
Yes. So I try to work it in that way so I can make it relatable because from what I learned, and I'll be honest with you, I have a short attention span. I need everything. Give me the visual. Let me write something. Let me see it on the board. Let me problem solve. You know, I need that all. And that's why I try to incorporate into my learning space.
Oh, that's awesome. That is really good. I do. I like that. So you talk about the relevancy of how to incorporate into public health. Do you mind help educating some people that public health has different areas?
Yes.
And I want to just address that. I think I want to let the community know that there are so many, because we want people to go into public health. We know that we're going to have people we need to go into public health.
Yes.
I want them to know it's not just one section, not just one area. There are multiple. Please inform us.
Yes. You know, I thought about this before coming to the show. So I told you I'm environmental health. That's a big area under public health. But there's epidemiology, there's health policy, there's community health. I feel like I'm forgetting one. Biostatistics and social behavior sciences. That's all tied into public health and more. It's growing. I've seen certificate programs where I graduated from, where they have maternal and child health. They have public health preparedness as a certificate option as well. So it's developing. You know, now we also have the importance of data analytics in public health. So it's a very broad field, but it encompasses so much, and there's so much opportunity.
That's good. I'm in the middle of reading this book. It's called and I don't have any backing of it, but I will mention it. It's called The Checklist Manifesto. It was recommended through one of my CE units that I was taking, and that's one of many books that they said you got to listen to. And what you just stated gave me an insight on something. They were talking about how, and I'm just stating, like in medicine, you knew you had a doctor, a nurse. But now you have physician associates, assistants, you have nurse practitioners. It's evolving.
Absolutely.
And you have DMPs, you have CRNAs. So he was explaining through the checklist, he was just giving us an idea that even when he was writing this book and things are happening, things are evolving. And that's one thing that I find that is really interesting, because listening to you, Dr. Robinson, you have evolved as well.
Thank you. Yes. Yes.
What does that feel like?
For me, it was always about staying relevant and staying current, because I see things change over time. Things change. Even where I live has changed over the past 40 plus years. It has changed. So I must change with it to keep up.
Yeah.
And that's how I feel, you know, and things are going to keep evolving, you know, and we have to be flexible and current.
I love it.
Have to be, yes.
Flexible and current. I think you learned a lot about that.
Yes. Yes. Yeah. Flexible and current for sure. Yeah.
So we're getting close to the end of this, but I have 3 questions. And the first one is, what is one instructional strategy that has been a true game changer for you?
One instructional strategy was applying what's on paper or in a textbook or in a lecture to a real world application, right? Bringing it so you can make the connections, because that's what it's about for me. I can memorize something and just keep reading words, but if I can apply it, then I know I haven't learned anything. And
Mm.
that's what I try to bring to the table in the classroom. Even as a food manager's training instructor, right? My responsibility is to make sure these food operators know what they're doing in their food service establishment. And I tell them all the experiences I had in the field with the operators. And I bring up so many scenarios and we talk about it and it becomes a discussion, because my feeling is their success is the health department's success. If they fail, we fail. So education is one of the most important tools. And I press upon them, or I try to impress upon them, that what was once acceptable yesterday is not acceptable today.
There you go.
I'm going to school and they send us so many webinars, and then they have to come every certain amount of years to make sure they're current. So
I got you.
Yeah.
Told you I got 3.
Okay.
Second one. What is one of your greatest moments as a health science professional?
One of my greatest moments. There have been so many. I would say when it comes down to a public health emergency that we've had a few hurricanes that really did some damage out here. I was proud that I was able to help my family prepare, and I was able to go to work with ease, knowing that they were okay. I think that's the most important thing for anybody in this field, because I'm going to tell you, from a local standpoint, local health department, when something like a hurricane happens, a pandemic happens, all hands are on deck. Doesn't matter what area you belong to. I work with people from early intervention. I work with people from communicable diseases. We all come together to make sure our communities are okay. So I think that was one of my most proudest moments. I know that feels a little simple, but for me, that meant everything.
No, it's not.
That meant everything.
You gave us a good piece of some gems right there. Let me tell you, because it's the truth. What you're doing is you're preparing others. Hold a second. First, you're preparing yourself, but then again, you're preparing others and educating others in the process, and then you're also helping your family in turn. And that's amazing. That's good. So since this is called cold press conversations, and I believe in cold press, we get the most nutrients from the cold press. If you would, I want you to send us off with one of your favorite cold press juices, and what would it be and why? How does it relate to who you are? Anything
pineapple and mango, or pineapple with a little bit of ginger. That's mine too. I know we were kind of having a conversation, and because it reminds me of a vacation, but pineapple and the ginger cleans you out. And then you feel better. It's almost like venting to somebody. You know what I mean? You held so much in the whole day, and then you vent to somebody, you feel better. And that's my pineapple ginger.
I love it. I love it. I love it. And to be honest with you, and I hate to say it, you have to have that refreshing feel, especially after working in a field that you do. And what you do each and every day. I mean, you got to have that form of refreshing moment. And I love it. Oh, we're going to come up with a recipe for that one. It's specifically called the Dr. K.M. Robinson drink or something. I love it. I do. This has been a wonderful delight, Dr. Robinson. I think we had a great time. I thank you so much. My intent is for others to understand public health. And you have given us so much in this process to understand the purpose of public health, what goes behind the scenes, how you're teaching your students. And that is extremely important. You're doing a lot, especially in your field, in your area, for the community. And so deep down, you are truly a health science educator. And I thank you for your time.
Thank you, Dr. Jewel. It was an honor to be here. I really enjoyed myself.
Oh, that's great. That is so great. So I thank everyone. Don't forget to share Cold Press Conversations with others, as well as invite others to Cold Press Conversations so they can learn more about health science, health care, and understand what it's like to be a researcher, instructor, or educator, as well as through clinical practices. I hope you enjoyed this episode of Cold Press Conversations. If you love this episode as much as I did, I need you to head on over and subscribe so you never miss an episode. This is Dr. Jewel signing off to health and cognitive happiness.